Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 right here in the studio. So we are with Maria right now. Let me see if I can find her. And there you are, Maria. Are you still with us?
Yes, I am.
All right.
Okay. So, Maria, we were talking about your mom is 78 and she has burning and stinging after a back surgery, and she also had her hips operated on and replaced. That's a lot of stuff going on for somebody. I don't care if they're 78 or if they're 20. And
yeah.
I think I heard you imply that she's thinking of another surgery. Is that true?
She is. She's been told that that nerve that's at L5S1 doesn't have enough room through that pathway off the spine, so that they have to clean that out. And
sure, no, I got that. And what was the first surgery in her back for then, if not that?
They kind of did the same things, but from L2 to L4.
Okay. Yeah, remember I said L3 is that area she was talking about with that lateral femoral cutaneous nerve? And that explains it. So, you just have to be careful because a lot of times when someone doesn't do well with one surgery, the second is not something to be looking forward to. So that's the statistics on it. So she's got to be careful. It sounds like she has some spinal stenosis, and they're going to do a little rotor-rooter to open up the area where the nerves come out so they're not impinged. Yes. But I'm not sure why they have to go do that a second time. I don't really know what's going on, I'm going to be honest with you, so I'm just guessing. But I would be very careful, and I would have her see some doctors who don't do surgery first to see if they can help. And that may even be a chiropractor, okay? It may be someone like me that does regenerative medicine with platelets and stem cells. Once you have a failure in a surgery, I'm not so happy about getting another surgery for someone. I'm not happy they ever had the first one, to be honest. But that's just little old humble me. I'm not telling you, the way it should be. But she didn't have a good result.
She's always been a very active person, and wakes up happy every morning. But now she can barely walk. And she used to walk everywhere, and now she's stuck to the chair. And it's
so sad. I'm so sorry.
Yeah. And I just thought maybe...
I'm just saying, get second opinions with people that are not surgeons. Okay. Because the surgical approach is the surgical approach. It's not good or bad. It just is what it is. You've already had a bad outcome. Why go for another one?
Well, she felt improvement above the waist, but she felt worse below the waist. So I think she's thinking that...
That's not... Yeah. I like things conservative. That's why I do regenerative medicine.
Okay.
I'm able to help tons of people.
Do you think that's an option for her?
I don't know. I have to examine her, or someone else has to examine her who's not a surgeon. We know what the surgical opinion is, so I'm not sure there's any point to go see another surgeon. You say get a second opinion. Either you find a very conservative surgeon for a second opinion, okay, or you go to other types of doctors who don't do surgery, who think they can help her in a different way that's not so invasive.
Yeah.
By the age of 78, you don't want to be having surgeries anymore if you can help it.
Yeah, everything else is great with her. She's a very, very young 78. It's just the spine,
Yeah, I hear you. It's no fun. How about yourself, Maria? How are you feeling?
Well, I'm in my 50s, and I've already had a hip replacement, and I've got a bad knee. So, and I'm told I need a partial knee replacement, and I don't want to do it.
Okay. Well, you're the one that ought to be talking to me.
Oh.
I don't know how much you know about...
Could you do something for the knee?
Well, I do knees all day long, so I don't know why not. I do hips, knees, backs, necks, shoulders, toes, ankles, wrists, fingers. There's no part of the body I don't do in the musculoskeletal system. I'm not going to help someone with pain from cancer because I don't do that. I do musculoskeletal work.
It does sound like I need to be talking to you.
Yeah. So, I get tons of people that are told they need a knee surgery or half knee replacement or full knee replacement, and we fix them up using platelets from their blood or stem cells. So I would, if I were you, go to my website, and you can watch me doing these procedures on the videos and see if it's something you'd want to do. The website, you can take this down, is www.lastemcells.com. I'll repeat it for everybody, www.lastemcells.com. Okay? And if you want to call into the office to get more information, the phone number to the office is 800-300-9300. 800-300-9300. But Maria, you probably had a surgery that I would have talked you out of. We have people come in all day that are ready to get surgery and never have to get it. I did have someone yesterday.
I wish I had known about you back then.
I'm going to be honest, totally, so we get everything transparent here. I had a beautiful gentleman come in yesterday, and he had severe hip arthritis in his right hip, and I couldn't move his leg, and I told him to get a hip replacement. Okay, so I'm not there to help every single person on the planet, but for most people, I can help them. Okay.
Well, I wish I'd known about you back then.
I can't remember before this gentleman yesterday ever telling someone to go get a surgery, but his was locked up. He had an injury a long time ago and never really took care of it. And I looked at his X-ray. There was zero cartilage. It was the real story of bone on bone. The bone in the femur was pretty much locked into the bone in the acetabulum in the pelvis. But, at the same time, I hear people come in every single day, and they go, I've got bone on bone, and I move the joint, and I laugh, and I go, you do not have bone on bone. Bone on bone means you can't really move that joint. It's locked up. So most people have some cartilage left. And if they have some range of motion, we can usually help them get better.
That's fantastic.
So I'd love to see you, Maria.
All right, well, I'm going to go take a look at your website.
Yeah, please do. www.lastemcells.com.
Okay,
a lot of videos
so much,
of me doing these procedures. God bless you. Thank you so much for calling.
Okay, you too.
Thank you, Maria. Excuse me. Our number is 866-870-5752, and we have Jackie in Los Angeles.
Jackie, Dr. Marc Darrow, I understand you have a bunion on your foot.
Yes.
And that's
small
something
one,
that...
It's hurt too.
Yeah, it's painful, I know. I had a very small one, and mine's all handled now. Oftentimes all we have to do is make some orthotics for you, which takes the pressure off of that joint. And we can also inject it with regenerative medicine, platelets, or stem cells, depending how bad the arthritis is there. It's an issue often that comes from overuse. Mine happened from playing tennis hours a day, just pounding the pavement. But a lot of people, it happens from being overweight, and we use a ketogenic diet for people that are overweight. I have all my patients who are overweight lose weight, and it gets the weight off of the lower extremity joints. When someone is a pound overweight, that's 5 pounds of pressure extra on the knee. So if someone is let's say 50 pounds overweight, that's going to be 5 times 50, which is how much? 250 extra pounds on the joints. Okay? So it's something we can help you with in most cases.
But doctor, I am not overweight.
I didn't say you were. I just said
no, I
generally.
Know. But you're saying people who are overweight, you explain the different.
You know, I can't hear you because your radio is too loud and it's echoing.
Oh, can you hear me now?
Can you turn your radio all the way off, please?
Yes, ma'am.
Thank you.
Can you turn your radio all the way off?
Okay, perfect.
That's the echo.
Okay.
Yes, doctor.
Thank you, Jackie.
Thank you, Jackie. So do you have anything else to add? Anything else to add about your condition that we don't know yet?
No, nothing else. That's about it. It's just this little bone I just received, and it just hurts. And I'm not.
I understand. I feel sorry that it does, and I let you know already that I think I can help you. I can't promise anybody anything, but we take care of the bunions all the time, and we can.
Well, so when can I come in, doctor? Where can I go?
Monday morning. You tell me when you want to come in, and I'll get you in. Sure, why not? I'll slip you in between patients.
All right. Address, doctor?
All
right, Jackie, God bless you. We'll see you soon.
Thank you, Jackie. And the office number is 800-300-9300 if you've decided you just want to call the office and make your appointment. Again, that's 800-300-9300. And check out the website at www.lastemcells.com. That's lastemcells.com. And the number to call us right here in the studio is 866-870-5752. Talk directly to Dr. Darrow right now. That's 866-870-5752. And remember, you get the free book today, Stem Cell and Platelet Therapy. This is Dr. Darrow's latest book, subtitled Regenerate, Don't Operate. It has 264 scientific studies. What do you think?
So, Nita, did you hear about the Italian chef who died?
No, he overate on the spaghetti?
Kind of. He passed away. Did you know there's 3 types of people in the world? 3. You know what they are? Those who can and those who can't.
That was only 2.
Okay, one last one. You ready?
Yes.
What do you call a can opener that doesn't work? A can't opener.
Oh my God! That's my favorite one. I love that.
All right, one more. These are all from my patients. They send me jokes all the time. Difference between ignorance and apathy. I don't know, and I don't care.
That's hilarious. That's a good one.
I like it. Let me take a question here before we get too much off track.
All right. Well, I just want to let people know I have lines open for you, 866-870-5752. Lines are open for you right now. We have lots of time left, but call now.
Okay. So this person writes in this morning, "Hi, I'm not sure if I'm a good candidate for stem cell therapy. I've had chronic back pain since 2013. Whoa. There wasn't an injury. I bent down to pick something up and was stuck on the floor for the next 3 hours. Guess what? That's an injury. I've seen doctors, chiropractors, therapists who all say it's muscular. Well, there's more than muscles in the low back, believe me. Exercise definitely helps with the pain. That's good. I exercise daily, and I'm a distance runner, but now have glute, that's the butt muscle, and hamstring tightness are coming into play, which is starting to aggravate my knees. Whoa. I use the Theragun, that's a vibrator, which helps, but I'm looking for more long-term solution. Please let me know if I'm a good candidate for your regenerative medicine of stem cells and platelets. I look forward to hearing from you." So I wrote her back, and then she wrote back and saying, "Thanks for your reply. I was running 4 days during quarantine, mileage 6 to 10 per day. Now that's a little excessive, okay? But was experiencing groin pain, so started cutting back. Good. The groin pain subsided, and now it's more of a hamstring and glute issue. Now I'm running 2 to 3 days a week, 4 to 6 miles, focusing more on weight training." Okay? So look, people come in every day with overuse syndromes, and this is one of them. Overuse syndrome, meaning you're doing too much. And this person didn't tell me their age, but, as a 15-year-old, you can get away with it. As a 50-year-old, you can't. And you gotta be judicious. I tell people not to do the same exercise 2 days in a row. Give it a chance to heal up. Do a different exercise the other day, and then go back to it. Typically, with low back pain like this, we can help that, and the practitioners who saw you say it's all muscular, and I'm going to doubt that. I'm going to guess it is the ligaments that were sprained when you bent over. Ligaments don't have a blood supply, so they don't heal on their own often, and we would inject that with platelets from your blood or with stem cells, and most likely I have to examine first, touch the area, but that's usually what it is, and that usually heals up and goes away. Now this is increased now to butt pain and hamstring tightness, so I've got to look at that and see what's going on, and then again now groin pain. So there's a lot going on. You are a complex patient, which I love. I love to figure stuff out. I do. It's fun. That's the fun of medicine to me, is figuring things out. And I would love to see you. If you want to come in, the phone number to the office is 800-300-9300. You folks can call now. We have people by the phone. And if you want to see what these treatments look like, go to the website, which is www.lastemcells.com. That's www.lastemcells.com. You can email me from every page, and you can watch me doing videos of these injections that I do to help people avert and avoid pain from musculoskeletal injuries, and avoid, most importantly, surgery. That's the name of the game. Don't have the surgery unless you have to have the surgery. You can always get a surgery if my treatment fails. Okay? I'm not telling you that my treatment works on everybody, because it doesn't. The biggest cause for it failing is people not doing enough of it. It's not a miracle. Typically it's not a one-time treatment. It can be. I've had parts of me that I self-inject that have healed overnight, and I've had several parts that have taken months of injections to heal. It just depends. I can't read my my crystal ball. I have one because I think they're pretty, but I don't know how to read the results. And so when people say, how soon will I heal, I never know the answer. I can tell them my experience in doing thousands and thousands of patients over the years. But medicine is a very, to me, it's a mystical kind of a science. And as they say, doctors practice medicine. It's not, to me, it's not science. Science is adding up 1 and 1 equaling 2, and medicine is not that way. There's so many variables that we can't control. We do research in our office on every patient, but that helps us nail down what's going on, but we still can't tell you what's going to happen with you.
Well, I guess because you don't have your crystal ball polished up. That must be it.
It's clean, but I can't see very well. So I'm going to give out the phone number to the studio right now. I'd love to have you call me before the end of the show. We have a couple minutes left. It's 866-870-5752. I'm going to repeat it for those of you driving. It's 866-870-5752. I'd love to hear for you. And in the meantime, I am going to take another question about shoulder. So let me see what this says here. Would stem cell fix my shoulder issue? Here's an MRI reading. Labrum, non-displaced tear. The labrum is, in Latin, it's lip. So there's a lip around the humerus bone which goes into the glenoid joint, and the labrum can be torn. It's noted along the base of the anterior superior labrum. That's called a slap lesion, with minimal extension into the base of the anterior labrum. Low-grade degeneration is noted at the base of the posterior labrum. Impression, chronic high-grade AC separation injury. So a lot of people have the acromioclavicular joint separated, especially when they fall off a bike or they fall with their hand backwards. It's very common. And if they have a bad enough injury, they'll have a lump on the top of their shoulder. Non-displaced slap lesion, which I talked about before. So I emailed back this person, and they wrote back saying, thank you for the response. My range of motion is very good. That's excellent. Pain is experienced by moving my right arm across my body toward my left arm. That's typically a sign of what we call impingement syndrome, where there's not enough room in the shoulder. There's a bursitis. What else? When I work out, the pain is intense. I find chest exercise the most important. That means probably that their subscapularis tendon is either worn down or torn. And this is something that I'd love to help you with. It's not as complex as it seems. Don't get a labral surgery. They typically fail. I can look inside with my ultrasound and look at that and see what's going on. If we do inject you, that ultrasound that I use can put the needle exactly on the right spot. So never get shoulder, knee, hip injections blindly, meaning without an ultrasound. The doctor does not know where that needle is going. He might tell you he does, but he does not. The studies show that if you do blind injections like that, you're going to miss the joint at least 1/3 of the time. And I had someone come in yesterday who had hyaluronic acid injected, Synvisc, and they got an allergy and had to get a surgery to clean it out because it went into the soft tissue instead of the joint. So if you're getting shots from your doc and it's in the shoulder, hip, or the knee, make sure he's got an ultrasound that he's looking inside the joint with to guide the needle to the right exact spot. So we've got Rose here, and your knee is bothering you, Rose. This is Dr. Marc Darrow. Rose, how old are you, please?
67. I talked to you last week regarding my RA. Yeah, I wanted to let you know, well, just quickly, because I don't know how much time you have, but I did go on that.
We have enough.
Oh,
you went on
great.
the alkaline diet that I suggested?
Yes, of course. No protein and just the fruits, vegetables. And
okay.
So
how did that work?
It's not hard for me to do anything like that because I've...
I know, but how did it work? Did it help you get rid of pain in the body?
Well, you know what? Because of the RA, this is what's going on with me.
Oh, you have RA, okay.
That's right. See? So on my knee, I tore my meniscus and asked my doctor, can you please just drain it? And he said, well, without the cortisone shot, it's really of no use. I said, no, I don't want that. But it can't, you can't help you unless you take cortisone. And I just thought, oh, my God.
Well, let me redirect you because everybody is chomping at the bit who was listening last week. You went on an alkaline diet. Was it 100% or did you cheat a little bit?
No, I don't cheat on that kind of stuff.
Okay.
I wanted to.
So we're all waiting to hear. Did some of your pain go away or not?
Oh, okay. Okay, I'm so sorry. Let me tell you, no. I thought that I felt it off and on during the week, but this is a problem, doctor. I'm supposed to be taking a medication, and I wanted to see if I don't want to take it. I'm nervous about it, and so it's new to
Well,
me.
I would listen to your doctor if he said take it, take it.
Oh, I'm so sorry,
Thank
Rose.
you
we're
all.
out of
Thank
time.
you, Nita, for being a good host. For those of you who want to go to the website and watch me doing these videos of regenerative medicine, of PRP, and stem cells, it's www.lastemcells.com. If you want to get to my office, it's 800-300-9300. God bless you all.
Thank you, everybody. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.